Is keto the magical cure for so many elements? And if so, why? Hi, I'm Dr. Hampton, and I'm on a mission to help you achieve metabolic health. In this video, I want to explain why using a keto hammer is exactly what you may be needing to do if you want to reverse and heal from chronic medical conditions. And I want to start by using this image, an image that clarifies the root cause of hypertension and cardiovascular disease. And in order to do that, we'll need to break it down even further. Let's start with the top, which talks about overnutrition. I would argue that that should be changed to carbs because of the macronutrients that can cause hyperinsulinemia, it is clear that carbohydrates are the one that will raise your blood sugar the most, therefore leading to insulin spikes, therefore leading to chronic hyperinsulinemia. That's what we want to avoid. One thing we can avoid is our genetics, and our genetics can't be changed. So we're not going to focus on that. We have a mom and dad, and they are who they are. We also some of us are on high dose insulin. That's something we get from outside our body that we use to treat diabetes. And in that case, until we heal, we may have to take insulin. But again, we're not going to focus on that. We're going to focus on the dietary approach. And as we go further down this slide, you notice that calcium does affect our vascular vessels. And what they do is they can directly and indirectly affect them. If we have calcium influx, it can then lead to constriction of our blood vessels, and we don't want that if we want to avoid hypertension. Now you can also understand that your kidneys can impact your blood pressure because if you have absorption of sodium into your body, that can then raise your blood pressure. So your kidneys are very important. And you may notice that sometimes people on dialysis struggle maintaining their blood pressure because their kidneys are working improperly. One of the mechanisms by which we do that is aldosterone, which does cause sodium to be absorbed. You'll also notice that there's endothelial dysfunction and macrophages coming in. All of this leads to inflammation. And when you see those arterial lesions, you could imagine that inflammation is going to cause problems in your blood vessels. There's also an increase in lipoprotein lipase in many cases when you see people at risk for cardiovascular disease. Now, if we go back up to the right of the slide, you'll notice that if you have chronic growth hormone production, that'll also be a risk factor for something called insulin resistance. And of course, inflammation will do that as well. One of the major sources of inflammation actually is stress. So we want to cut down on stress, get enough sleep so we can avoid that as well. When that occurs, your arterial endothelial cells won't make endothelial nitric oxide. And when you don't make endothelial nitric oxide, you're at risk for constriction. So as you can see from this image, there are multiple ways for us to increase our risk for high blood pressure and cardiovascular disease. But I have a question for you. I want you to pause for a second. You may even want to stop the video. Where do we have blood vessels, right? What do you think the answer to that question is? Well, I would argue pretty much everywhere, right? So if we have blood vessels everywhere, just like the pipes in your house, if one pipe is clogged, it's likely that the pipes in the other parts of your house are clogged. Same is true for your blood vessels. Your blood vessels are everywhere. So if we solve the problem of hyperinsulinemia, we will solve the problem of many chronic medical conditions because you have blood vessels everywhere, except for one place. The only living cells in the body that aren't directly served by blood vessels are those in the cornea of your eye. Other than that, we want to have healthy blood vessels because they are really foundational in our health. Now, I want you to consider this as well. The metabolic syndrome is a clustering of problems associated with resistance to insulin and or hyperinsulinemia. So this is very important to consider. Why? Because it is clear that many chronic medical conditions that we worry about are due to poor metabolic health. So if we treat and or use carb restriction keto to put this into remission by avoiding hyperinsulinemia, we will reduce our risk for not only hypertension, but cancer. Cancer cells love sugar. It's called the Warburg effect. And so if we reduce sugar or glucose in our body, then we'll have less cancer. Polycystic ovarian syndrome, of course, heart disease, dementia is called type 3 diabetes. Now you probably understand why. Non-alcoholic fatty liver disease, and of course, issues with our cholesterol. And the obvious one is diabetes. But there's a problem. It seems like there are forces out there that don't want us to know this information, right? And it's almost like they want to fade this information away from our existence. And in fact, if you look at people that we follow on YouTube and social media, like Dr. Ekberg, Dr. Berg, Dr. Ken Berry, Dr. Boz, and of course, Violet of the Road to Health YouTube channel. And I really appreciate her because she focuses on how we feel about our lifestyle changes and how we think. They have literally attempted to censor the information they're trying to share. And what they're trying to teach us is that keto may be the perfect tool to prevent and reverse this hyperinsulin state. It's the keto hammer that they don't want you to know about, because keto, unlike most dietary patterns out there, is particularly designed to reduce the carbs, which is the main reason why we have high insulin spikes. So if we have a dietary pattern that reduces the main reason why we have insulin spikes, it's likely, very likely, that we won't have blood vessels that are diseased, leading to all of those chronic medical conditions that are associated with metabolic health. So this is the problem, guys. We live in a world where we focus on not teaching about reducing carbs and keto and using lifestyle. Instead, we live in a world where we focus on using medicines, procedures, and surgery. And I want to kind of explain, using that same graph, how this works. So if we start with a medicine that's extremely popular out there, like Jardiance, right? Jardiance works by having you to excrete out in your urine the sugar, the glucose that you consume. Wouldn't it make more sense to just not consume the carbs? Wouldn't that make more sense? And then if you look at a drug like amlodipine or nifedipine, those drugs are calcium blockers, right? So instead of having us focus on reducing hyperinsulinemia, which will avoid the influx of calcium, just take a medicine that blocks the calcium instead. What about nitroglycerin? Of course, you're familiar with nitroglycerin because that's the drug we use if we're having chest pain, and it helps to open up the arteries. Now, your body naturally makes nitroglycerin in the endothelial cells of the arteries, right? But instead of us avoiding insulin resistance with our diet, we're just going to have a pill to take when we have chest pain. Now, furosemide is another example. Now, this is what we call a loop diuretic, and it acts by causing more sodium, chloride, and potassium to be excreted in the urine. So instead of focusing on your diet, which will then lead to a reduction in the reabsorption of sodium, we're going to take a medicine to do it instead. And then, of course, there are a slew of blood pressure medicines that are out there that we use to control our blood pressure. But again, wouldn't it make sense to take a dietary approach instead? And of course, statins, right? Everybody wants you to take statins, not just because it reduces your LDL and total cholesterol, but if you didn't get the memo, statins actually reduce inflammation as well. So there's all of these different mechanisms that result in the reduction of inflammation, reducing calcium influx, and other mechanisms. But my message to you today is that instead of focusing on that, which I think is okay as bridge therapy, right? I think it's okay to use medicines as bridge therapy. In fact, I encourage you to use medicines as bridge therapy until you heal. But let's not silence my colleagues out there, right? Let's focus on sharing the good news that and changing your diet is really all you need to do. And then you use medicines as bridge therapy until you heal. I always tell my patients when I see them in clinic that there are many roads you can take to healing. it's like a fork in the road. So you can either go in the direction of more medicines, procedures, and surgeries, or you can go in the direction of changing your lifestyle. And I would argue, based on what I've shared today, that if you take the road of less insulin spikes, your return on investment will be tremendous, because there's about an improvement in 70 to 80% of all so-called chronic medical conditions by simply reversing hyperinsulin states leading to insulin resistance and all the things that I've shared today. So the goal, as you try to heal, is to focus on what is the root cause of why I'm ill or getting sick. And if I focus on that, then I won't end up with the diseases that result. And I would argue, based on this video, that what you want to do is use your keto hammer so that you won't have all of those excessive carbs in your diet, resulting in hyperinsulinemia. So I really hope this message of a simple approach, a simple focus on reducing the carbs using your keto hammer has resonated with you. If that makes sense to you, please share this video with friends and family so that they can learn these simple principles and they won't have to live a life of using chronic medicines forever. If you like this video, like, share, and subscribe. And until the next video from the Metabolic Health Doc, continue to be safe, be well, and continue to protect your nest.